Hey guys, I wanted to make a quick video on my ride home to discuss tummy tucks. So I actually just had a tummy tuck done, or actually just did a tummy tuck, I should say, for a patient who is in her 50s. She's had children. She was just left with some fatty tissue of her abdomen, excess skin, as well as her back. So we ended up doing liposuction of her back and then a tummy tuck for her. But I had someone ask me whether or not drainless tummy tucks were safe. So I will say that majority of what I do are drainless tummy tucks. That was just how I was trained as well, as to do drainless. And patients do pretty well with those. It is a safe procedure. And so what the difference between a drainless and a drained tummy tuck just has to do with how you manage the potential for fluid collections post-operatively. So whenever you elevate the skin for a tummy tuck, you have to sew it back down to the abdominal wall. And that potential space that has not been created with surgery, the body likes to fill up any potential space with fluid. So you can leave a drain to allow that fluid away out. But what people complain about with drains is that where it comes out of the skin, so it's a plastic tube that comes, that's left in the surgical site, and then it comes out of the skin to a suction bulb. And where that tube comes out of the skin, some people complain that it's very tender, it's uncomfortable. But some patients might just be squeamish and can't imagine managing a drain at home. So drainless tummy tucks have become very popular. And what that is instead of leaving that potential space and putting a drain, what you do is you add some additional suturing to essentially suture that skin that you just elevated back down to the abdominal wall to decrease the chance of fluid collecting in that space after surgery. So it might make your recovery a little bit more uncomfortable just because there's more suture work, but in general, patients do pretty well with that procedure. And like I said, that's what I tend to do. So yes, it is a safe procedure. It's something that I'm comfortable doing. But if for whatever reason somebody is just freaked out about the idea of having a drainless tummy tuck, I can still do them the traditional way with using a drain. So it really comes down to kind of patient preference and patient's ability to either manage a drain or not wanting to manage a drain post-operatively. But either way is safe. And it doesn't really change your overall recovery. It doesn't really change your overall result. It's more so a matter of whether or not you have to deal with a drain after surgery. So if you guys have any other questions or other topics you want me to talk about, just leave them in the comments below.